Assalamualaikum Dokter Burhan.
Betul Nining.
Assalamualaikum warahmatullahi wabarakatuh.
Suara saya
Pun,
jelas Mas. Jadi ini saya nggak pakai mic.
oh nggak
Oh,
jadi pakai headset dok.
Berat.
Benjinan sebelum mulai udah pakai kok.
Lah suaranya sudah jelas nggak?
Sampun,
jelas.
sampun.
Tampon clear.
Ada
Ya
dokter
sudah.
buruan ke, sampun.
Soalnya udah banget ini berat aku.
Saya sini hanya mantau dok, hanya ngerekam. Pun
Heeh.
monggo silahkan.
Saya juga hanya menilai. Monggo silahkan.
Apa sih? Wis aku rampung, orang loro ya. Aku neurologi wis rampung.
Aku neuro yo wes ya.
Matur nuwun, Amerika. Nggih. Oh, nggih matur nuwun ya. Nggih, monggo. Nggih.
Bocor Mas jadi
Nggih.
Bu Andin, nanti saya dikabari ya kalau mau memulai ya.
Yes, kita ini masih still waiting for the presenter.
Assalamualaikum, Dr. Nur Azia.
Waalaikumsalam warahmatullahi wabarakatuh. Sorry because I has actually joined in the main meeting room.
It's okay, Doctor. Can we start this event presentation?
Yeah,
Dr.
sure.
Nur Azia. Okay.
Yeah, sure.
Dr. Dodi, Dr. Andin, Dr. Burhan, can we start this presentation?
Yes, Dr. Neneng.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good afternoon, ladies and gentlemen. First of all, we would like to welcome you for joining us on the International Conference on Health and Well-being on 6 December 2023. I'm Nining Lestari. I will moderate these sessions. We have Dr. Burhanuddin Ihsan as our jury today, and Dr. Nur Azia Nordin as our invited speaker from UC Malaysia. Okay, first of all, we would like to please that quite number of participants has registered to join this conference. And in this parallel room, we have 10 presenters in total. So we will divide the presentation and discussion into 3 sections. Each section consists of 3 to 4 presenters. And then 3 presenters will present their article for about 10 minutes. And then we will have the discussion after the presenter number 3 or 4. So we will have about 1 hour for each sections. And then presenters doing their presentation by their presentation. And then before we begin, it seems that we need to agree some terms and conditions in order to ensure the event will running well. Okay, all participants, voice should be mute during the event. And then participants can ask questions using 3 methods on Zoom. You can raise hand or using chat line or speak directly after the third or fourth presenter. Okay, the event will be closed with a photo sessions. Kindly please turn on your camera on the end of the sessions. Okay, before we begin the first sections, I would like to welcome Dr. Nur Azia. Okay, Dr. Nur Azia, please welcome. And then we will have a first presentation from our invited speaker, Dr. Nur Azia Nordin from Faculty of Medicine and Health Science, University Science Islam Malaysia. The topic is alkaloid as potential BCL-XL inhibitor through molecular docking studies. Please welcome Dr. Nur Azia.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you to Madam Moderator. So I will share my screen to everyone. Okay, I hope you can. My screen can be seen now.
Yes.
Yeah, Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Nordin. I'm from Faculty of Medicine and Health Sciences, University Science Islam Malaysia, USIM. So today I'm going to be presenting a project entitled Alkaloids as Potential BCL-XL Inhibitor through Molecular Docking Study. So this is actually preliminary of our study. So this will be the outline that I'm going to talk after this. So basically, I would like to introduce you. So what is the BCL-XL? So BCL-XL is a protein, an anti-apoptotic protein that belongs to a BCL2 family. So this protein is actually a vital regulator of mitochondrial-mediated apoptosis. And what happens is this protein is overexpressed. It will actually lead to tumorigenesis and cancer chemotherapy resistance. So as we all know, cancer is uncontrolled growth of abnormal cell in the body and cell divide quickly. So cancer is one of the major causes of death worldwide for morbidity and also mortality. So by how to actually treat this cancer, by we postulate or we hypothesize that alkaloids can be one of the way to treat the cancer. So in this study, we hypothesize that apophene alkaloids, which mostly actually isolated from Malaysian plants, second largest group of isoquinoline alkaloids, where these alkaloids are based on the 4H dibenzoquinoline structures of its 3-methyl derivative, which is commonly known as the apophene nucleus. So apophene alkaloids derive from S-reticulin as it undergoes intramolecular carbon-carbon bond formation, which lead to the formation of the tetracyclic apophene structure. So this group of apophene alkaloids, depending on the degree of methylations at the nitrogen atom. So these are the some introduction of this study. So we hypothesize that alkaloids can be a BCL-XL inhibitor because BCL inhibitor or protein is among specifically targeted anti-apoptotic proteins which were less reported previously. So by having these alkaloids, we hope that it could be mimicking BH3 only protein, which is the natural ligand that bind to the BCL-XL and at the hydrophobic group of BCL-XL protein. So based on this hypothesis, our objective of this study to study the alkaloids as potential BCL-XL inhibitors for cancer pharmacotherapy. So if you can see from this illustration, so what we postulate from this study or mode of action by having these alkaloids is to mimic the actions of BH3 only protein, which can bind to the pro-apoptotic protein and therefore will trigger the apoptosis pathways and eventually to kill the cancer cells. So we come to the methodology of this study. So basically this study is about simulations where we use the computational study by doing this molecular docking. So all alkaloids were retrieved from the PubMed databases and the structure were downloaded and converted into PDB-QT format prior to ligand preparation using AutoDocVina. So preparation of these ligands or alkaloids using the AutoDocVina, and we do the clean geometry to minimize the energy of the ligands. And for preparation of the micromolecule, which is the BCL-XL, this 3-dimensional structure of BCL-XL was obtained from the RCSB protein database, which with the PDB ID 3ZK6. So preparation of this molecule is we eliminate the water molecules from the protein structure, and the hydrogen atoms were added, and non-hydrogen bonds were merged to the BCL-XL. So preparation of this micromolecule or BCL-XL is using the Autodoc tools version 1.5.6 software. So this is how the molecular docking was done. So the docking simulation study was conducted in 8 alkaloids. So these all 8 alkaloids are apophene alkaloids, which previously reported and isolated from Malaysian plants. So the prediction of interaction and binding affinities between alkaloid and BCL-XL protein were done using AutoDocVina software. So the reputation for this docking was set to 100 exhaustiveness, and the ligand was directed. All alkaloids were directed into the BCL-XL active site. So the position of the interaction or the docking is actually in grid box on X, Y, and Z positions, where the highest evaluation number was set to 500,000, and the rest of parameter was set as default. And the binding interaction, where we do the analyzing of these interactions using BioVia Discovery Studio Visualizer 2017. So now we come to the most important part of this presentation, which is the results and discussion. So these all 8 alkaloids, apophene alkaloids, were docked with BCL-XL, and we analyze their binding and affinities and also the interactions between the ligands, which are the alkaloids, and also the BCL-XL. So based on this table, we can see that all alkaloids seems to have quite similar in terms of binding affinities, ranging from the -6.9 to -8.2. So the highest binding affinities that you can see here is the lirodinine, okay, which is minus 8.2 as compared to other alkaloids, suggesting that lirodinine has a bit stronger binding energies as compared to other alkaloids. So if you can see the hydrogen bonds that form between the ligands and also the BCL-XL, we can see that one hydrogen bonds was formed in all alkaloids except the aniline and also lirinidine. And we can see most of the alkaloids bind to the BCL-XL at the arginine 139. You can see arginine 139 is one of the residue that actually form the interaction between the alkaloids and also the protein at most of the alkaloids. Okay, so other residues, amino acid residues that form between the ligands and also BCL-XL, we can see it forms the hydrophobic interactions. Okay, so for this figure shows the 2D and also 3D structure where how the alkaloids bind to the BCL-XL. So you can see the red box here is actually the amino acid residue, which is the arginine 139, which is interacted most of the complex between the ligands and also the protein formed between these complexes. Actually, it's a critical residue that located in the P2 and P4 pockets in the hydrophobic group of the BCL-XL, where this is the place or the conserved region where the inhibition occurs between the ligand and also the BCL-XL, because our aim is to inhibit the process so that the pro-apoptotic, the natural ligands that bind to BCL-XL will bind to the pro-apoptotic and trigger the downstream effect, which is the apoptosis process. Okay, so you can see here arginine 139, which interacted in most of the alkaloids, form here in most of the alkaloids in these complexes. Okay, so this is all for the molecular docking, which we look into the interactions and also the binding affinities among all 8 alkaloids, apophene alkaloids with BCL-XL. So to sum up of this study, the preliminary study is all alkaloids predicted which dock between the alkaloids and also BCL-XL protein have significant binding interaction to be developed as potential BCL inhibitors. But because this is a preliminary docking result, so we need actually more investigation in terms of the simulation, which is the molecular dynamics, as well as experimental studies to prove or to strengthen these findings for the discovery of new pharmacotherapy drug for cancer. So before I end my presentation, I would like to quote this one verse from chapter 3, Ali Imran, where Allah said, our Lord, you have not created all of this without purpose. Glory be to you, protect us from the torment of the fire. As we know, alkaloids are the component or element that actually exists in the plants. So plant is not only to give nutrition to our body, it can be also beneficial in terms of the treatment. Okay, one of it is for cancer. So that's all from me. Thank you.
Thank you very much, Dr. Nur Aziah Nurdin, for your presentations. Okay, the participants can ask some questions to Dr. Nur Aziah about the alkaloid as potential BCL-XL inhibitor through molecular docking studies. Anyone? Okay. There is a questions from
On the chat box. Yeah.
Yeah.
For this in silico study, could you explain your method and minimum requirement for software and hardware that needed? So we use actually Autodoc tools to do these minimizations, okay, for the ligands. And the hardware that you need is definitely the workstations. And we also use the GGPU for this kind of study, because to make it the faster running of the and of the molecular docking itself.
Okay. Okay, thank you, Dr. Nur Azia. Other presenters can ask the questions. Maybe I would like ask question, Dr. Nur Azia. From all alkaloids, which one is the most potential BCL-XL inhibitor as a potential BCL-XL inhibitor, Doctor,
Okay.
and why?
Okay, based on the result, this is just a preliminary result, so we need to confirm more on the molecular dynamic afterwards. But based on this molecular docking, we can see that lirodinine. Lirodinine has, I would say, slightly better than other apophyl alkaloids that we have tested, which given minus 8.2 binding affinities in terms of the binding affinities. And also it has one hydrogen bonds, and some of it is interactions of hydrophobic interactions. So based on these 8 apophyl alkaloid, we can say that lirodinine is slightly better than others because the binding affinities between all alkaloids have not much difference. But the strongest one I would say is lirodinine.
Okay, so the alkaloids as potential BCL-XL from about inhibitor binding or what?
Yes, yes, as an inhibitor of BCL-XL.
Okay,
Yes.
thank you very much, Doctor. Anything else from presenter?
May I ask one question to Dr. Aziz?
Yes, sure.
Okay, Dr. Rian, Ibu
Okay.
Rian.
Afternoon, Sis Aziz. Nice to meet
Hello,
you
my sister.
here. Nice to meet you here.
Yes.
Yeah. Can I ask? Maybe we already intensely discuss about this, yeah. But I want to ask, based on the result of your molecular docking study, do alkaloids have potential as BCL-XL inhibitors in all cell types or just in a certain cell?
Okay, because this docking is done straight away, directly to the active site of BCL-XL. So if the cancer cell lines, if the any cell lines or any cancers that have very high expression of BCL-XL, so we assume that the alkaloids that we have tested for the molecular docking can also be interacted with the BCL-XL, which high expression in that particular cancer. So we postulate that way, we hypothesize that way. So to prove that, so it must be in the experimental study, but we can hypothesize that can be actually give a good result in terms of the inhibitor of that particular cancer if it has high expression of BCL-XL.
Okay, so we can treat any cells with alkaloid to detect anti-apoptosis marker, BCL-XL. Yes.
Yes, correct.
Thank you, Sis Aziz. Thank you very much for your attending. Thank you very much.
Thank you, Dr. Nur Azia Nurdin, for the presentation. After this, we have a first section of the first presentation. For Dr. Nur Azia, would you like to join the presentation?
Yeah, I
Or-
can stay.
Okay.
If I can stay from the organizer can allow me to stay, I will stay.
Thank you very much, Doctor. Okay, now we would like to invite for the three of the first presentation.
Maybe Dr. Nining, I will divide two rooms because there is two team in biomedical and also clinical. So the presenter in room 2 could go to the room 2, medicine 2. Thank you very much.
Okay, thank you, Dr. Dodi. Okay, for first room, we have the first sections. Now I would like to invite the presentation. Dr. Yusuf Abdullah Aziz. Okay, thank you, Dr. Yusuf. And then Dr. Yuni Prasetyo. Not yet. Dr. Iin Novita. Okay, not yet. Okay, Dr. Fandi Akbar Briliantama. Dr. Fandi Akbar.
Present, Doctor.
Dr. Fandi Akbar.
Present, Doctor.
Okay, and then Virgil Zelindra.
Present, Doctor.
Virgil Zelindra. And the fourth, Fania Kurota Ain. Fania Kurota Ain. Okay, so we will present the four for the first sections. Let's begin. I would like to welcome the first presentation from Dr. Yusuf Abdillah Aziz, the analysis of family functioning and mental health on medical student learning achievement. Okay, are you ready, Dr. Yusuf Abdul Aziz?
Yes, Doctor, I'm ready. Okay, I will share my presentation. Okay, can I start, Doctor?
Yes. It's clear.
Okay, thank you, Dr. Nining. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. First of all, I would like to thank Allah Subhanahu wa Ta'ala who has begun giving us blessing and blessings so we can attend today's good condition. The Honorable Dr. Burhanuddin Ihsan, Master of Medical Education as a Jew. The Honorable Dr. Nining Lestari, Master of Public Health as moderator. I am Yusuf Aziz, a student at Medical Faculty Muhammadiyah University of Surakarta. And in this occasion, I will present our research entitled is Analysis of Family Functioning and Mental Health on Medical Student Learning Achievement. Okay, this is our outline that I will present on this occasion, and I will explain why I did this research. This research is motivated by the fact that currently we have entered the era of globalization. Globalization is a challenge that we must face, and globalization has an impact on various sectors. One of which is most affected is education. Education sector will be required to be able to make a significant contribution, and students will be required to have very high achievement in social life. Student learning achievement can be seen from the cumulative achievement index or GPA, grade passing average. And to achieve learning achievement, factors are needed that support a student, including family, function, and mental health. To achieve a learning achievement, parental guidance is needed as part of family function. In a study, family can provide positive motivation so that children are enthusiastic about learning. In other research, it states that learning achievement depends on family circumstance. And a similar research was concluded that the family has a strong positive relationship with student learning achievement. Another factor that influences learning achievement is mental health. Mental health has negative implications for health and quality of life. According to data, the prevalence of depression in Indonesia in 2018 was 6.1%, and mental emotional disorder was 9.8%. In a study, it was stated that mental health has a relationship between learning achievement. In other research, it also stated that significant and positive relationship between mental health and student learning achievement. The aim of the research is to determine the relationship between family function and mental health on medical student learning assessment. Okay, this research has quantitative methods, namely analytical, observational with a cross-sectional approach. And this research was carried out at Faculty of Medicine Muhammadiyah, University of Surakarta, with a sample of students from the 2020, 2021, and 2022 classes who already had GPA. The sampling technique used in the research was stratified random sampling, and the sampling size obtained was 92 respondents. Family function data was collected using the Upper Family Questionnaire, mental health data using the S21 questionnaire, and learning achievement data using GPA. Okay, there were 92 respondents in the study, and the analysis of the relationship between two variables using T-square test. In the test, the relationship between family function and learning achievement, the value of 0.006 was obtained, so it can be concluded there is a significant relationship between family function and learning achievement. And because the p-value obtained was less than 0.05. Apart from that, the family function variable can be included in the multivariate analysis stage because the p-value is less than 0.25. In one study, it was stated that family function was one of the factors that influenced learning achievement. And in other research, it also stated that parent and cultural backgrounds will also influence student learning achievement. In the second T-square test, namely testing the relationship between mental health and learning achievement, there is p-value 0.0004, so it can be concluded that there is a significant relationship between mental health and learning achievement because the p-value obtained less than 0.05. Apart from that, the mental health variable can be included in the multivariate analysis stage because the p-value is less than 0.25. In one study, it was stated that mental health plays an important role in learning achievement. And it was also stated in other research there is strong and significant influence between the influence of mental health and increasing student learning achievement. Mental health disorders are one of the predictor of learning achievement. For the multivariate test, the study used logistic regression analysis. The result of science show that family function has a partial influence on the cumulative achievement index with p-value 0.013, which means a p-value less than 0.05. And odds ratio or expected p-value 3.681, which means family function influence 3.6 times learning achievement results. Meanwhile, the correlation between the cumulative achievement index or GPA is obtained p-value is 0.0, so that interpretation of the result is that mental health has a partial influence on the cumulative achievement index. And odds ratio or expected p-value is 5.4, which means that mental health influence that result 5.4 times learning achievement. In the study, this influenced the family and environment, mental health, and learning discipline on learning achievement. Okay, the conclusion is based on the research result, it can be concluded that one, there is a relationship between family function and learning achievement. Two, there is a relationship between mental health and learning achievement. And three, there is a relationship between family function and mental health with learning achievement. Okay, that's all presented regarding my research. If there are any shortcoming in my presentation, I apologize and I will try to improve it. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Yusuf Abdillah Aziz. Next paper is from Fandi Akbar Briliantama. The topic is subjective experience of listening to favorite songs and murotal in young adult men with quantitative electroencephalography analysis case series studies. Okay, please welcome Pandi Akbar Briliantama.
Okay, is my voice clear?
Yes.
Okay. Thank you for opportunities. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Good afternoon, ladies and gentlemen. First thing first, in the name of Allah, the Beneficent, the Merciful, all praises be to Allah, the Lord of the world, the Master of the Day after, the Creator of everything in this universe, so we can attend together and gather in this event without any obstacles. How are you all today, ladies and gentlemen? I hope you're doing great. Now we are going to present our research with title Subjective Experience of Listening to Favorite Songs and Murotal in Young Adult with Quantitative Electroencephalography and case series study. But before we come to this presentation session, let me introduce me and my friend. My name is Naswa Sekar as a presenter 1, and Fandi Akbar as a presenter 2, and Rahmadini Putri as a presenter 3. Then, well, I think that's enough about the introduction session. Let's come to the next session. It will be the presentation of this research. Because I'm the first presenter, I will begin the presentation. Here it is. The introduction about this research is the activity of listening to music and Al-Quran Murattal is an experience of consequences with an auditory type of sensory entry. This experience of consciousness is unique depending on one's subjective phenological experience. The aim of this case series study exploring subjective phenological experience in young adult healthy men into objective simple neuroscientific data. So basically, we compare what is different about a young man listening to music and listening to Muratal Al-Quran. And then the problem statement. We have 3 points in here. The first point is the subjective experience of listening to music and Muratal in young adult men has not been extensively studied. And then the second point is the neural processing and mental activities associated with listening to music and Murotal are not well understood. And then the last and third problem statement is the impact of music and Murotal on the emotional and cognitive states of listener has not been truly investigated.
And the next is objective. Objective or purpose or aim of this research is to determine the subjective experience of young adult men will listening to music and Murotal by analyzing stress using QAEK or qualitative electroexonography and ERP or elevated relation potential examination. And then the object of observation, and the first is it is a hope that listening to music and Murotal can trigger nervous process and mental activity in young adult men when listening to Murotal and songs. And second, ERP or event relation potential pattern are associated with specific mental activities such as aging awakening, meaning creation, and aesthetic awareness. And third, music and Murotal Al-Quran have different influence on the emotional and cognitive state of the listener. Murotal Al-Quran has more significant influence on physico-spiritual awareness and emotional regulation. And the fourth, There are differences between men and women in neural response to music and murotal, where men show weaker and slower response in auditory processing, while in terms of working memory performance, there are contrasting brain structure with are mostly the occipital, parietal, and temporal.
Okay, thank you for the opportunity, Tama. I want to explain the next presentation, this methodology. The study is type of Caesarean. It's which the patient young adult men were asked to close their eyes for the approximately 50 minutes and were examined using Q, EEG, and ERP while listening to Al-Quran, and the song. The QEEG examination uses a sample 10 until 20 system EEG tool, which are commonly available in the health facility. Measure brain electric activity using the traditional even relay potential or ERP method by the comparing the average alpha power during and even listening to music or monotal compared to the average alpha power during basal conditional. And then the analysis carried out the looking of the pattern of ERP increase at curtain electroda, which was associated with the subject phenomenological experience of respondent when heard music or murotal Al-Quran.
Then I will continue about the result. In this result, we use 4 men. The first man is initial with Y, 19 years old. You can see it here. He listening a song called Without You by Avicii with 118 until 120 BPM. It is finding from quantitative electroencephalography of music. The result of this research, the heart rate frequency at baseline was 60 times per minute, and listening to music is 60 times per minute. There is a lateralization to the left with dominance in the occipital, temporal, auricular, and frontal lobe areas. This dominance is likely because the mental activity used by the subject is to generate image of pleasant memory experience, and then stable heart rate. And then from the finding from quantitative murotal electroencephalography result, you can see it clearly in here. The heart rate at baseline was 60 times per minute, and while listening to murotal is 54 times per minute. And then there is lateralization to the left with dominance of the occipital, temporal, and auricular, and then frontal areas. The increases in ERP activities with left lateralization may be related to the subject's processing of visual imaginary image of our countries. The subject is in a relaxed condition as seen from the stable pulse frequency at 60. And then the second result with initial F, 19 years old male, he heard song or he listening song from Nadine Amizah with 87 until 92 BPM, and you can clearly see it here. The heart rate at baseline was 78 times per minute, and when listening to music it was 90 times per minute. And then the ARP tends to be large in the left hemisphere. There is an opposite impact on the heart rate per minute. The ARP reduces the heart rate and increase. And then these young men also heard the murotal, and then we find from the quantitative electroencephalography result, the heart rate at baseline was 78 times per minute, and when listening to murotal, it is also 78 times per minute. And then a rightward lateralization tendency for ERPs with less negative values. When listening to murotal, the heart rate is the same as basal. Listening to murotal is more relaxing.
Okay, thank you, Naswa. I want to next explanation the result. And number 3, male, 20 years old. finding from the quantitative electroencephalography of music, and the music is the Nadine Amiza. And the heart rate frequency at baseline was 16 times per minute, and when listening to music, 72 times per minute. ERP is a tendency for lateration to the right, especially in the middle temporal and prefrontal area. There is a slight increase in heart rate. Then finding from the quantitative Morotal, the heart rate baseline was 16 times per minute, and when the listening to the Morotal, 78 times per minute. For the middle temporal area, this is a lateral zoom to the right, while for the prefrontal and frontal area, there is lateration to the left. There is a slight increase in pulse frequency compared to basal condition. And then number 4, there 90 years old male, finding to quantitative. The song is Jason Pranti Under Yellow. The heart rate frequency baseline was 84 times per minute, and while listening music it was 90 times per minute. An increase in ERP in the prefrontal area, while though the prominent increase in ERP was seen in older electrode, there was an increase in heart rate compared to baseline condition. And then the finding from the quantitative Morotal electroencephalography results, the heart rate at baseline was 18 times per minute, and when listening Morotal is 19 times per minute. EP increase in the left prefrontal region, but not followed by the typical pattern of dominant of curtain temporal or occipital region. There is an increase in heart rate compared to basal condition.
And the last is question. The experience of awareness of listening to auditory sensation originating from listening to favorite song and Murata Al-Quran is a unique experience that differs from one person to another. The network of brain region involved depends on what mental activity is dominant during the conscious experience of listening.
And then here's the several references that we use. And then the last thing I want to say, thank you for your attention and thank you for the listening. Sorry if we have any mistake. And I will close this presentation by wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Pandi Akbar Briliantama and friends. Okay, the next paper from Phil Jalinda, the relationship of hemoglobin and ureum levels to the death rate of patients with leptospirosis. Please welcome Virgil Jalindra.
Permission for the share screen.
Okay.
Okay, baik. Bismillahirrahmanirrahim. Good afternoon. Thank you for the giving me the opportunity until this moment in this honor to attend this presentation. Assalamualaikum warahmatullahi wabarakatuh. Here I am. I'm presenting about the relationship of hemoglobin and ureum levels to the death rate of leptospirosis patient. Honorable jury and respect audience. Okay, table of the content. First, introduction. Second, method. Third, result and discussion. Fourth, conclusion and suggestion. Five, reference. First, background. Leptospira infection can be caused by contact with soil or water that has been contaminated with body fluids, or the urine of other animals that have been contaminated with Leptospira bacteria. Leptospirosis migrate through mucous membrane or damaged skin. Transmission of leptospirosis can be caused by direct contact of animal infected with leptospira with human or not direct contact with puddles of water contaminated with urine contaminated with leptospira, so that the bacteria can enter the body through the mucous membrane. The high cause of death in the case of leptospirosis, which generally have a history in endemic area, are acute kidney injury and pulmonary hemorrhagic syndrome. So this is the background. Leptospirosis is a disease with a high burden. In the United States, there are 1,000 to 2,000 cases identified each year. The incidence of leptospira in tropical area is almost 10 times that or more temperate climates. The world 103 million cases, Indonesia 920 cases, and Jawa Tengah 22 cases. This is the all the factors. First, acute kidney injury, and then pulmonary hemorrhagic syndrome. And then method first, there's research is a multi-center, and then study with correlation, which aims to see the relationship between hemoglobin and urea level and mortality rate in leptospira patients. Second, this is the research cross-sectional study in which the research sample was taken from medical record data for 2018 until 2023. And then third criteria for leptospirosis 80 years old, and then the research sites at PKU Muhammadiyah Hospital, Dr. Saidiman Magetan Hospital, and Kartini Karanganyar Regional Hospital. And five, data analyze using the chi-square method or multivariate analyze. Logistic regression was used to analyze the relationship between blood hemoglobin level and urea level on the death rate of leptospirosis patient and the determinant and dominant factor in leptospirosis. This is the result and discuss. This is the picture. So this is the picture. First, the age. The research result are the basis for the showing that of the active leptospirosis sufferers. 7 patients did 70 people improved, and 3 people were not identified because maybe pasien APS atas permintaan sendiri, and the causes of the leptospirosis sufferers recorded in the medical record of the 3 hospital could be caused by various transmission factors. Okay, this is the table about show that 77 patients who meet the inclusion criteria. One third person was aged 12 until 25 years old. And then with the most common gender being male, 69 or 86%, and female 11 or 13.8%. Based on this demographic factor, the most patients suffering from leptospirosis is between 46 until 65 years. This is because older people are usually physically weak and can easily catch infection disease. The result of the current study show the X factor is not statistically significant related to death rate leptospirosis patient P more than 0.05. In health adult, the number of leukocytes depend on many different factors such as age, gender, health, and status. For example, the trauma, infection, sepsis, and age-related disease age. So the picture, the youngest the suffers is 90 years old, and the older suffers is 91 years old. The average age of sufferer is 46 years old. This is because the risk complication, previous disease history, a great influence on the mortality of leptospirosis patient, apart from mortality prognosis indicator, namely age more than 60 years. Okay, this is the leptospirosis and criteria. Fine criteria are clinical manifestation of leptospirosis diagnostic based of symptom, epidemiologic, laboratory parameters. The result from medical record data obtained result of 2713 more or less 184, which is within the criteria for confirming a diagnosis infection with the leptospira. The WHO introduced find the criteria for the diagnosis of leptospira. The fine score obtained for each patient using clinical, epidemiologic, laboratorium, and clinical value. A score of 25 or more for section A plus B plus C, or score 26 or more for section and A and B is considered suspect leptospira. This is the result for the routine blood. This is for the result, clinical and relationship between the factor of the infection disease leptospira and the patient mortality rate, HB, and SGOT examination are statistically significant, while other factors such as leukocyte and kidney function, particular urea in this study had, and the statistically significant relationship. This the value indicates a decrease in liver function. So this the leptospirosis not always for creatinine and ureum for low. This is all the factor in the patient. The low hemoglobin anemia and high urea level tend to poor nutrition stational because they experience decreased appetite, nausea, vomiting, and weight loss. Poor nutrition status can affect the immune system, fluid, and electrolyte balance, the patient quality of life. First, example, chronic kidney disease, and then quality of life maybe have not sanitation and environment not clear. This is the conclusion and suggestion. Several demographic and clinical factors from the result of this study can be concluded that most of them are not statistically significant P more 0.05 within the death rate of leptospirosis patients. Specifically, what was study was that hemoglobin and urea had a statistically significant relationship. This is because the most common cause of leptospirosis cases in general kidney disease case what found more than 70%, and pulmonary hemorrhagic syndrome was more than 10%. This is okay. Thank you. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Zelinda. Next presentation is phenomenological analysis of distress experiences in high school teenagers. Please welcome Fania Purata Aini.
Okay, thank you, Dr. Nining, for the attention. I would like to share screen for first. Okay, I will start this presentation. First of all, I would like to say thank you for the committee who giving us the opportunity to participate in this event. And all of attending, let us introduce ourselves. My name is Fania Kuratu as a leader in this study, and our member is Ilham Hafiza, Nadia Ra, Alia Teda, Muhammad Priya, and our lecturer Dr. Yusuf Alam Ramadan. Before that, in this opportunity, I would like to present a journal and total phenomenological analysis of distress experience in high school teenager. This study aims to gain in a deep understanding through of a phenomenological approach regarding stressor, biophysical, emotional impact, and coping strategies. And so the phenomenological approach was used to explore unique individual experience related to mental distress in adolescent high school students. So let's talk more about this study.
Okay, let me start first this presentation. The mental distress is emerging as a noteworthy concern among high school students, with a study revealing that 1 in 6 students grapples with excessive distress. Mental distress in high school adolescents can be attributed to factors such as bullying, serious trauma, academic difficulties, financial problems, feeling of isolation, and lack of parental support. In-depth understanding, particularly the subjective phenomenological aspect of mental distress in adolescents, especially high school students, is still limited. When delving into the conversation about stress, there are two related terms: eustress, which denotes positive stress, and distress, which signifies negative stress. This research focuses on distress, a multifaceted and unpleasant encounter that can hinder one's ability to cope effectively with life challenge. Distress raises substantial concern due to its lasting effect on variety of physical and mental health conditions. A thorough investigation of the origins of stress, coping mechanisms used by adolescents, and their subjective reaction to stress using a phenomenological approach has not been conducted in the Indonesian context. Therefore, this study sought to provide a descriptive picture of the phenomenology of stress, biopsychosocial emotional effect, and strategies in students of SMA Muhammadiyah 1 Surakarta.
Okay, the second point is about methods. In this qualitative study, we use some characteristics of the phenomenological approach. There are the first, pragmatism, which focuses on outcomes and the practical aspect. The second, empirical phenomenological method. The third, microphenomenological analysis with use of the interview. In this study, we took the age of respondent around 14 and 17 years old. So, the informed consent is given to the teacher or class guardian. Data mining was carried out during the Bulan Bakti event with a focus on mental health as a community service program carried out by the Student Executive Board of the Faculty of Medicine, Muhammadiyah University of Surakarta in August 2023 at Muhammadiyah 1 Surakarta High School. Data collection in the study was performed through in-depth interviews. So, informed consent was given to the subject as a form of consent before following all research procedures.
Next, for the result, the total number of respondents we got was 93, consisting of 45 men and 48 women. Then, we got 482 quotes from the transcript selected for content analyzing of our study. Then, from these quotes, we classify them into three based on the type of stressor stimuli. Second, response to stressor stimuli and type of coping strategy. The results that we have analyzed in general can be seen in the table that has been displayed.
Okay, next we will discuss 5 things which are the main topic in this research, and there is a stress typically, emotional or cognitive response, physiological response to distress, behavioral response, and coping strategies. Let's start from where does stress come from, or we can call it stress stimuli. We found that highest search stressors were dominated by 2 things. There is an academic problem and there is an interpersonal problem. Yeah, we can see this from the following expression. Saat kelas 3 SMP, saya mendapatkan juara tryout 10 besar, tapi orang tua masih kurang puas dan masih menuntut buat 3 besar. Saya diminta untuk jadi polwan dan saya juga sudah berusaha mengimbangi dengan ikut taekwondo dan les akademik juga. Padahal saya lebih cenderung ke non-akademik. Terus akhirnya saya stres kalau nanti gak bisa seperti apa yang diharapkan sama orang tua saya. After knowing the source of stress, what are response to stress, or we can divide into 3 things. The first is emotional or cognitive response. The expression bad mood was the most frequently expressed distress-related emotion by respondents, followed by upset, angry, sad, and anxious. The experience that states is agak bad mood aja sih Kak, kayak nggak mau ikut aja gitu. Kalau pusing sih enggak. And the second is physiological response to distress. The most frequent and highly related physiological response to stressor experienced by students include dizziness, palpitation, and feeling hot. And this is expressed with pusing, panas, deg-degan, terus diem, tapi kadang nggak sadar malah keceplosan marah gitu sih, Kak. The symptoms appear to be unique and not commonly mentioned in this exciting literature. And the third is behavioral response. The primary behavioral response to stress are dominated by withdrawal, crying, and getting angry. The term bad mood often accompanies these 3 dominant behavior. Withdrawal and response to stress express, saya merenung, menyendiri, dan merasa pusing. Crying behavior as response to stressor is expressed as rasanya emosi, mau nangis, mau sendiri aja. Anger can also be a behavior display in response to stress as a narrative. Rasanya mau marah sama diri sendiri, mau teriak. And it was found that some respondents report engaging in self-harm behavior as a response to stress. And the last thing we need to know is how to deal with this stress, or what we call coping strategy. The coping strategy developed to finding of this study fall into the 3 categories of behavior. There is a behavioral, exhalation, and cognitive. On coping strategy with behavioral approach, the first ranking include a sleeping, and the exhalation, the first is tell to the friend, and the cognitive approach includes a self-introspection. And the coping strategies chosen can be related to the locus of control, which is the belief in one's ability to control desired outcome or self-efficacy.
So, the conclusion, the phenomenological study underscores the distinct stressor faced by adolescents, particularly high school students, tied to their developmental stage, traumatic experience, and the pivotal phase of career preparation. The utilization of the term thought, the understanding stress response encompasses thought process, emotion, and the prevalence of specific thought in the minds of Indonesian adolescents is indicative of stress. Unique physiological symptoms such as elevated by body temperature during stress are noted, contributing a less common finding in the literature. Coping mechanism involve a preference for confiding in friends over family, with a reliance on gaming and social media, while rarely used, coping strategies are less frequently employed. These findings shed light on the nuanced nature of adolescent stress and provide a valuable insight for further exploration and intervention.
Okay, and this is our reference for this journal article, and maybe this is enough from our presentation about phenomenological for teenager. Thank you so much for the attention. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you for all speakers on the first sections. Now I'm inviting for the discussion, feedback or observations. Okay. Now please the listener to ask the questions. You can raise the hand or send the question to the chat line. Okay, from the presentant, you can also ask question to other speaker or other presentant. Okay, maybe I would like to ask for the fourth speaker, yeah, why the coping strategy are less commonly, what is called, coping strategy in religion are less commonly among the students. How do you think about that? For the fourth presentation. On the conclusion, you said that religions are less commonly as a coping strategy among the students. Fania Surata Aimya from the fourth speaker. Maybe one of the presenter from the fourth paper can
Oke,
give.
oke. Boleh saya izin masuk? Sorry with mix mixing language. Yes, it is interesting finding. In this millennial student, we less find religious coping strategies. The mostly social media. This is our challenges for our education for the teenager about how to increase religion as coping strategi. Bagaimana menjadikan bahwa coping strategi ini menjadi religius ini menjadi sesuatu yang bisa diandalkan. I think from the answer from me, maybe Mbak Fania can add the answer.
You can answer in Indonesian, blended.
Because Mbak Fania is the leader in di lapangan
Izin untuk menjawab menggunakan bahasa Indonesia yang Dr. Titik dan juga juri. Mengapa religius tidak menjadi hal yang utama atau menjadi last common di hasil penelitian kami? Karena di sini dikatakan bahwa coping strategy such as distract, deep breathing, and relaxation and social activity are generally correlated with better mental outcomes. Jadi banyak remaja sekarang seperti kita tahu bahwa dengan berkembangnya zaman, dengan banyaknya teknologi yang sudah berkembang, sosial media sudah bukan menjadi hal yang awam bagi kita semua untuk dalam kehidupan sehari-hari. Sehingga yang menjadi kebiasaan remaja saat ini adalah menggunakan sosial media dalam kehidupannya sehari-hari, sehingga remaja merasa bahwa dengan adanya sosial media, dengan melakukan hal-hal yang bisa dilakukan secara online, bertemu dengan teman, menggunakan adanya hiburan yang di sosial media, mereka merasa bahwa strategi coping seperti pengalihan tersebut dan juga dibanding dengan beraktivitas sosial umumnya itu berkorelasi mempunyai outcome mental yang lebih baik, karena pembagian strategi coping itu secara bisa kita di sini juga dikatakan bahwa ditargetkan untuk mengatasi stres akademik dan adanya coping strategi ini berfokus kepada masalah dan fokus untuk mencari alternatif dari penyelesaian masalah itu sendiri. Jadi kenapa banyak yang mencari alternatif itu ke dalam sosial media yang merupakan highest common di hasil kami, dan mengapa religious ini jarang ditemukan, mungkin karena dengan adanya perkembangan dari teknologi tersebut. Mungkin seperti itu, dokter. Terima kasih.
Okay, thank you, Dr. Yusuf and Fania Kuratau. Okay, the next question may be from Virgil Zelindra. Yeah. Okay, you can unmute and ask directly.
Thank you, Doctor. Excuse me, Doctor. I have the question for the presenter, Yusuf Abdullah Aziz. For the question, why do you have to choose? Why did you choose the title of this result? Thank you.
Excuse me, doctor, can I answer?
Yes.
Yes. Okay, thank you. Why did I choose the title of this research? Because currently the education is expressing intense competition. Every student have desire to achieve a good learning achievement. However, there are various factors that influence learning achievement, and I'm interested in research in whether there is a relationship between mental health and family function on learning achievement. Okay, I think that's all. Thank you, doctor.
Okay, any feedback again from Is clear?
Maybe not feedback, Doctor.
Okay, thank you. Okay, next questions. Raisen Yusuf Abdullah Aziz. Okay, you can ask directly to the speakers.
Okay, thank you, doctor. I want to question for Philippine Selindra. And this question is, why do you have to choose the standard diagnostic vein criteria? Thank you.
Okay, Philippine Linda can answer on the questions about the fine criteria to leptospirosis.
Okay, thank you, Dr. Ning and presenter Yusuf. Okay, the question tadi, why do you have to choose standard diagnosis fine criteria? Okay, because not all developing countries have the tools, modern example, MAT gold standard diagnostic, microscopic agglutination test can be implementation for developing country, not all the developing country for implementation. This is because the limitation for the modern tools the standard diagnosis, the diagnosis criteria for leptospirosis are need because the diagnosis leptospirosis for the criteria fine or fine criteria using clinical that A and that B epidemiology and that C laboratory. That fine score is obtained for each patient using clinical, epidemiology, and laboratory according to the established clinical value for each patient. A score of 25 or more for the section A plus B plus C, or score of 26 or more section A and B is considered suspect leptospirosis. Increase the incidence of this disease in poor countries means that more prints and discriminating diagnostic criteria for leptospirosis are needed. Maybe this is the answer. Thank you.
Okay, thank you. The next question. Still tunggu ini ya, questions ya. Naswa Sekar. Okay.
Okay, thank you for the opportunities. I would like to ask for Fania's group. The question is, how do you collect the data for the research? Thank you.
Okay, thank you for the question. Let us to answer the question. So, it has been stated that we had in a deep interview regarding questions such as what causes you express stress, what do you feel emotionally when expressing stress, and what bodily response do you experience during stress, and what strategy do you use when expressing stress. And open-ended questions are instead allowed to subject to express themselves freely and describe their own experience. And informed consent also provides to the subject as a form of approval before participating in the entry research produced. And all interview activities are recorded and verbatim transcription are created for use in the analysis. And content analysis is used in the analysis method involving coding and categorizing. And so data collection took place during the Bulan Bakti event with focus on mental health in event of Student Executive Board of Faculty of Medicine Surakarta in August 2023. Maybe enough, there is a feedback maybe. Thank you.
Okay, any feedback from Naswa or enough?
Enough, thank you for the explanation.
Okay. And then the last questions from Ilham Hafiza.
Okay, thank you for attending for this opportunity. I want to ask for the Fundis group. My question is, what makes you choose this subject, or what's your reason? What's your reason to interesting this subject to your research? Thank you.
Okay.
Okay.
Who will answer the questions?
Okay. Okay, thank you for the question. I will answer the question. So, what is the reason Why is the reason that we choose this subject is because we are really interested in how the emotional impact is in a person if he listen to his favorite music and listen to the Muratal Quran. So we know that most people now is prefer to listen music or listen the Muratal Quran. Beside that, we also the reason is also no one has previously studied the neurological effect of comparing listening Quran and listening music. I think that's the reason.
Okay, thank you, Nashwa Saka. Any feedback from Ilham? Jen?
Thank you.
It's enough, clear, right?
Enough.
Okay. That is the end of the first sections. Okay, before we go to the next section, I would like to remind you to fill in the attendance presence on the Google form that attached in the Zoom chat. Okay. Okay. I would like to invite the three presenter for the second section. Dr. Iin, Novita. Are you ready, Doctor?
Okay, thank you, Dr. Nining.
Okay, and the second maybe Hana Hairunisa. Kana Hairunisa. The third is, what is it? Tada. So the second section, Dr. Iin, and then Kana Hairunida. Dr. Iin first or Kana Hairunis?
Kana slide is already on, so please
Okay,
can begin her presentations.
Okay, Dr. Iin first, yeah. Hana Hairunisa, can you stop the screen? And Dr. Iin will start the presentation. Thank you.
Thank you for this.
Present, doctor.
opportunity.
Sorry, we have a little problem in here.
Okay, it's okay.
Okay. My slide is already appeared, yes?
Yes, Doctor.
Okay. Okay. Thank you for this opportunity, Dr. Nining and team, also for the Ichwb committee. This evening, I would like to present our case series report about high mortality among clinically pneumonia infections in low CD4 HIV patients. For introductions, in 2016, there are more than 40,000 new cases of HIV infections. This makes our country in the third rank in the Asia Pacific regions. In 2019, the peak of HIV cases in Indonesia reached more than 50,000 cases, spreading in all over Indonesia. Our patient clinical characteristics are very different from asymptomatic patient until fatal outcome. we had identified some mortality factor in our HIV patients. The low CD4 count less than 50, the moderate and severe degree of anemia, the low body mass index, delay HIV diagnosis, and stage of HIV at diagnosis. CD4 number predict the severity of illness and significant factor for morbidity and mortality. The lower threshold for serious opportunity infections is set at CD4 count less than 200. The rate of HIV disease progression speeding up among our patients when their CD4 drop until less than 50. So we try to identify the clinical characteristic, risk factor, and causes of death in such patients. That is very important, especially in health facility where CD4 count are not available. So this effort is to carry out optimal management of HIV patient for reducing the progression of infections and saving life. We recruit 3 new patients in our hospital. These patients suffer from severe opportunistic infection leading to high mortality rate. Our data, including demographic data, clinical characteristic, laboratory data, chest X-ray, and final outcome. Okay, our first patients here, 28 years old male, MSM is male, sex male, yeah, laki-laki suka laki-laki. He came with complaint 3 months of shortness of breath and fever, up and down fever, dry cough, and also loss of her body weight. He was previously hospitalized with the same symptom, but not fully recovered. From physical examination, we found febrile tachycardia with oxygen saturation 94 until 98 in room air. His BMI is 17. He had candidiasis oral and bronchovascular sound of both lungs. From laboratory examinations, he had slight anemia. His leukocyte is still normal. A slight increase in hepatic transaminase enzyme. His SARS-CoV-2 antigen was negative. His CD4 is 11. Our normal CD4 for normal person is 600 until 1,500. So this is very low. And he also tests for HIV, 3 times positive result for anti-HIV. His radiology examinations shown infiltrate bilateral in both lungs. So we assess these patients with HIV infection stage 4 with candidiasis oral and clinically PCV infections. He was treated with oxygen supplementations, 3 liters per minute nasal cannula up to 10 liter because he experienced a decrease of oxygen saturation until 90% during these hospitalizations. He was also given nystatin, fluconazole, and cotrimoxazole according to his weight and steroid titrating dose. His second thoracic functions give better performance, so his infiltrate is reducing. He is clinically recovered and was discharged from the hospital in day 9. So, and he is planning to start IR-free regimen after 20 days. Okay, our second patient, 31 years old man. He is also an MSM. He was complained of prolonged fever, loss of weight, shortness of breath. This is his 3rd episode of hospitalizations. Previously, he was entered hospital for 5 days due to typhoid fever and dry cough. He enrolled again with also fever and admitted loss of her body weight and diagnosed for his HIV at the 2nd hospitalization. This is his 3rd hospitalization episode. From physical examination, we can find here his blood pressure is still normal. He has tachycardia, temperature is still normal. He has high respiratory rate, 24 times per minute. His oxygen saturation at the time is 94. Room air, BMI is 20. He has oral candidiasis, bronchovascular sound of breath, PPA on his both arm, leg, and back. His laboratory examinations, there is no anemia, leukocyte count normal, there is slight increase enzyme transaminase, and this patient also had CD4 7, so it's very, very low. We can see here the radiology examinations is biliary diffuse infiltrate in both lung. His screening for SARS-CoV antigen is negative. His screening for mycobacterial tuberculosis also negative. This patient assessed with HIV infection stadium 4 with candidates oral and PPA. He initiated with 3 liter per minute oxygen supplementation, cotrimoxazole, steroid, nystatin, and fluconazole. In day 5, his condition was not getting better. His saturation continued to drop 91 and then continued to drop. Then he was transferred to ICU. The second X-ray examination showed the worsening of bilateral pneumonia. So we decided to give broad spectrum antibiotic for nosocomial infections. In day 7, his oxygen saturation continued to drop until RT3. He had ventilator support for almost 7 days, but unfortunately, he was died after 50 days of hospitalizations. The third patient, a 26 years old man, also MSM, he was admitted that he had already known about his HIV status since years ago, but he decided not to get the therapy yet. The patient complained over the past 3 months, his health condition was declined, his weight has decreased, and he had fever and also diarrhea. From physical examinations, we can see here her red blood pressure is still normal, heart rate 118, respiratory rate is 30. His oxygen saturation at the enrollment is only 75, and then it can be rose until 95 with NRM nasal face mask. He has also oral TRAS and PPA. His laboratory examination, he has no anemia, leukocyte count still normal, increased enzyme transaminase, and his CD4 is 12. From radiology examination, we can see that they are infiltrate in upper right lung field and also lower both lung. So we are very suspicious for tuberculosis with secondary infections. We assess this patient with SIV stadium 4, suspicious tuberculosis, and clinically severe PCP infections. He started cotrimoxazole, nystatin, fluconazole, steroid, and azithromycin. In day 7, he started become more agitated. His oxygen dropped, so he's transferred to ICU and got ventilator support. The screening for SARS-CoV-2 negative, rapid anti-TB also negative. His second X-ray, we can see here, show more complex and severe consolidations, especially in right lung. The patient died on the 8th day. So we have 3 males here. All of them are less than 40 years in productive age. The risk factor is all MSM, laki-laki suka laki-laki. They all have the specific mucocutaneous manifestation for HIV, which is oral candidiasis and PPA. The hematology alterations is anemia only for one patient, and all of them has CD4 less than 15. This is indicate that all of these patients will come very late for diagnosis and treatment. And all of the causes of the death was because of pulmonary infections with clinically pneumonitis pneumonia and secondary bacteria. Only one patient survived from these 3 patients. PCP is common, especially in very late HIV infections. Overall, 25% of PCP patients did not recover from the conditions. About 40% of them needed critical care, and among 40% of them, 60% of them are die in the hospital. The diagnosis of PCP is very difficult because the symptom is very lightly. 7% are asymptomatic. The physical examination and chest X-ray radiology are similar for other bacterial infections. So we cannot also get routine PCP culture in our hospital because it's very difficult to obtain. So all we can do is if the patient very suspicious for PCP is the patient with oral candidiasis with advanced stage and very low CD4. So we give prophylaxis that can reduce mortality. Common symptoms for PCP include fever, non-productive cough, and some of breath, which are found months before the appearance of clinical symptom of VCP, patient may experience symptom of respiratory failure such as tachypnea, tachycardia, cyanosis. They require mechanical ventilations and vasopressor. The crepitations and crackles also found in the occupation of the lung. In mild case, pulmonary abnormality are barely found. In severe case, the characteristic is the decrease of partial oxygen pressure and the risk of respiratory failure. So for conclusion, VCP is one of the fatal opportunistic infection in HIV. HIV is necessary to be diagnosed as early as possible so that patient can start ARV at early stage to improve their prognosis. Thank you for this opportunity. Thank you,
Okay.
Dr. Neneng.
Thank you, Dr. Iin. Would you like to present second paper
Okay.
on the next section?
Okay. My second paper.
Yes.
Okay. Okay. Thank you. Sorry. Okay.
Antiviral and symptom 3
Okay.
days for confirmed COVID-19 students.
Thank you, Dr. Neneng. This is our second paper about the antiviral and symptom-free days for confirmed COVID-19 students with my student Sila Fadila Sifak. Yeah, she is graduated already from Medical Faculty of FKUMS. For introduction, we all know that coronavirus disease first discovered in Wuhan, China, then declared pandemic by WHO in March 2020. The choice of antiviral at the time is very diverse. And because of the very fast rate of disease transmissions, so there are limited healthcare facilities. The healthcare facilities only focus on moderate and severe cases of COVID-19. So asymptomatic cases or mild symptoms are advised to self-isolation. The availability of antivirals for self-isolation patients is often very limited. In the end of self-isolation, patients also recovered, but the recovery can be longer than the patient who received antiviral. So we try to identify the symptom-free days in confirmed COVID-19 patients who are self-isolation between those receiving and not receiving antiviral. This is a cross-sectional study. We included 93 confirmed COVID-19 UMS students who performed self-isolations from March until August 2020. The inclusion criteria is subject with comorbidities such as heart disease, chronic lung disease, cancer, diabetes mellitus, obesity, and hypertension. The subject fill in a questionnaire online using GFORM, which question about the length of their symptoms, the antiviral status, their demographic data, and we analyze this GFORM data with SPSS, and we also get ethical clearance from Health Research and Ethics Commission of Medical Faculty UMS. Result, yeah, so we can see here we have 93 enrollment subjects. Most of them are 18 until 25 years old because most of them are UMS students. Most of our subjects are women, and most of them come from general medical faculty, density faculty, pharmacy faculty, and FKIP faculty. Jadi most of them are from health medicine faculty. We also asked the student about how their perceptions about the subject COVID-19 infections. Most of our subjects state that the COVID-19 infections are very dangerous, and the rest state this is quite dangerous. Yeah, only one student at the time mentioned that this COVID-19 is not harmful. Most of them mentioned that they obtain this virus from family and surrounding environment. This is interesting because only 3 of them state that they have the virus from hospital and workplace. So most of them get the virus from family and surrounding environment. Only 3 of our subjects are smoking, and most of them had symptoms, and most of them report the symptoms from 8 until 40 days. There are also a subject that report after 40 days, they still have their symptoms. The description of their antiviral and self-isolation locations. Yeah, most of our subject, all of our subject finish their isolation time by the 14th day. They report they get their isolation from the house, and also there are 30 students facilitated in UMS boarding to finish their isolation time. Most of them take medicines. Most of them state their compliance with taking their medicines. Most of the students are not get antivirals because it's very difficult to get antivirals at the time. The symptom of 3 days, most of the students state their symptoms is 8 until 40 days. The symptom post self-isolations, there are some students who state that there are still symptoms of when they finish their isolations. This is the statistical analysis. We try to make to analyze the result of the analysis of the differences in COVID-19 symptom-free days according to the provision of antiretroviral. We can see that here that students with get the antiretroviral, his days, 3 days, 3 days symptoms are 8 days, but students who are not given antiretroviral stated that they symptom-free days is 12 days. For discussions, findings are relevant to the systematic review reported by Reggio et al. That the administration of antiretroviral resulted in faster symptom-free days than in patients who were not given antiretroviral. Guideline for management of COVID-19 actually published for the first time or the latest recommended the use of antiretroviral not only in severe patients but also in mild to moderate self-isolation patients. In this study, the type of antiretroviral given to the patients are oseltamivir, and also one of them get the favipiravir. Giving antiretrovirus then can shorten the symptom of 3 days. You can see it here with antiretroviral, the symptom of 3 days is 8 days. Without antiretroviral, the symptom of 3 days is 12 days. Many students, we have limitations in our study. Many students were not recorded in the study because not all of them checked by not all of them check the conditions to be confirmed positive or negative for COVID-19. Symptom 3 days in the study may also be caused the symptomatic graph obtained by the students. Students were not also differentiated according when the initial time of administration of antiretroviral. It has only been carried out on a student population who has no comorbid, and there is not carried out swab evaluations to determine whether the patient has fully negative from COVID-19. The clinical degree of the disease was not identified by laboratory explanations and doctor judgment, whether it is true, mild, or actually it is a moderate symptom. For conclusions, the antiretroviral accelerate the achievement of symptom-free days. The following research should consider about the anxiety factor, the familial risk report, time for initial administration of antiretroviral, the degree of disease, and the presence of comorbid, and the result of swab evaluation at the end of isolations. The community should provide support in any form, even it is small, because it's very important for COVID-19 patients' healing process. Thank you. This is the end of our presentations.
Thank you, Dr. Iin, for the second paper. We will have a break for Asar prayer. Maybe we will 15 minutes break. So we will join again on the Zoom at 15 okay. 15 minutes from now. Then the next presenter is Mbak Hairunisa, Kana Hairunisa, but we will have a break for Asar in 15 minutes. Okay, please.
Yes,
For,
Doctor.
okay, okay.
Yes, Doctor. Thank you for your information.
Okay, for all speaker can unmute and off the camera if you want to pray Asar. We will continue in 15 minutes. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, shall we continue? Okay, Mbak Kana Khairunisa, are you ready for the next presentation?
Ready, dokter.
Okay. Please, Mbak Kana Khairunisa.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Good evening, everyone, and sir. So, in this evening, I will explain about subjective experience of listening to favorite song and mortal in young adult women with quantitative electroencephalography, analyzed the case series. And the member of this journal is Ayudhya in R.A., Mariani, Kana Herunisa, and Dr. Yusuf Alam Ramadan. Next. Introduction. The study explored the concussion experience of listening to music and chronic recitation or mural in relation to health benefit while both engage the auditory sense. Music and mural differ in spiritual context. The research aimed to understand these unique conclusions experience of neuroscientific examination using AAG analysis. The study investigates alpha power during music and broad listening compared to baseline condition in young, healthy women. The findings suggest a correlation between mental activities and distinct ARP patterns. Listening to music induces neural arousal and meaning creation, influencing emotion, cognition, and behaviors. Music rhythm and tones evoke varied neural response, triggered emotion, and memories, impacting cultural and individual identity. On the other hand, brutal listening evokes a spiritual consciousness tied to prior life, resulting in catharsis, relaxation, and emotion relief. This unique experience is influenced by gender, education, and one's spiritual connection to the Quran. Studies reveal that mortal activities, anti-mental imagery, and episodic memory network, even potentially aiding coma protection conclusion in ICU setting. In essence, the research delves into the distinctive neural response to music and mortal, reflecting their individual impact on conclusions and health. Next, problem statement. 1. The subjective experience of listening to music and mortal in young adult women has not been extensively studied. 2. The neural processing and mental activities associated with listening to music and mortal are not well understood. 3. The impact of music and mortal on the emotional cognitive states of listener has been thoroughly investigated. Objective. The objective of the study was to explore the subjective experience of listening to music and mortal in young adult women using quantitative electroencephalography, or QAAG, analyzed and the related potential ARP approach. Next, object observation. 1. Listening to music and mortal triggered unique neural processing and mental activities in young adult women. 2. The ARP patterns were associated with certain mental activities such as the arousal of neural processing, meaning creation, and aesthetic awareness. 3. Music and mortal had different effects on the listener emotion and cognitive states, with mortal having a more significant impact on psycho-spiritual, consciousness, and emotional regulation. And 3, there were gender difference in the neural response to music and mortal, with women
showing stronger response in certain frequency bands. Methodology: the study used a case series design employed QAAG and ARP technique to analyze the neural activity of young adult women while listening to music and mortal. The QAAG examination used a simple AAG device of the 10 between 20 system, which is commonly available in healthcare facilities. The ARP approach compared the mean supply alpha power during the event listening to music mortal with the mean sampling alpha power in cell condition. Next, the result showed that listening to music mortal was associated with specific neural activities, mental processing in young adult women. The conscious experience of listening to music and mortal was one to be influenced by gender difference, education level, and the intensity of a person's psychospiritual interaction with the Quran. Next, its conclusion. The study concluded that the subjective experience of listening to music and mortal in young adult women can be correlated with specific neural activities and mental process, as evidenced by QAEG and ARP analysis. The findings suggest that music and mortal have unique impact on the emotional and cognitive states of listeners, with mortal having a more significant influence and psychospiritual consciousness and emotional regulation. Further research needed to explore the underlying neural mechanism and the effect of music and mortal on different groups of listeners. Thank you. And this our reference. And the next, thank you. Thank you for your attention. So the next, do you have any question?
Okay, thank you, Kana Khairunisa. Please stop the screen, Mbak Kana. Okay. Thank you for the presentation. Now I would like to please the listeners to ask the questions. Anyone ask the question? Maybe I will ask the question to Dr. Inovita.
Yes, please.
Okay, Dr. Inovita, I would like to ask why the steroid used for the first case at the presentation, Dr. Iin, and why we should titrating the steroid dose for these patients. Thank you, Dr. Iin.
Okay, thank you for the questions. So steroid is one of the drug choice regimen for is cotrimoxazole high dose according to their body weight, 15 milligram per each kilogram, rather than divided dose 3 until 4 times a day. Then we also add steroid in regimen of treatment.
Can increase your volume, Dr. Iin.
Yes, pardon me?
Can increase your volume.
Oh, okay. Okay. It sound better?
Yes.
Dr. Nining?
Yes,
Okay.
Dr. Iin.
Okay. So steroid is included in all the patient because this is the treatment for PCP. So the treatment of PCP is cotrimoxazole high dose according to their body weight, divided dose 3 until 4 times a day. We also give steroid in order to reduce the hypoxia of the patients. Usually the PCP came with moderate or severe symptoms. So we use steroid. We can use prednisone, methylprednisolone, or dexamethasone, high dose for 21 days, tapering off every day according to the clinical response of the patient. So the majority of our patients is already given the steroid high dose, but eventually only one survived in our case series.
Okay, thank you, Dr. Iin.
Okay, thank you, Dr. Nining.
Okay, any questions from our presenter? Please raise your hand or send your question to the chat room. Okay, may I ask one question again, Dr. Iin? Because it's interesting presentation, yeah. On the second paper, when this study conducted, it is about the COVID-19. It conduct at the early COVID-19 era or at the Delta variant era?
Okay. This research conduct on March until August 2020. So I think it's the peak of the first gelombang of COVID-19. It is gelombang pertama, the first gelombang, and the second gelombang, Delta gelombang, is on the end of 2020. So this is the first gelombang of COVID-19 in Indonesia, March until August 2020. Yeah. So it is not the Delta. It's before. I forgot. It's not the Delta pattern. It's before.
Okay.
Okay.
Yeah, thank you, Dr. Iin. For Pak Ana Khairunisa. Kana, can you share the conclusion? I want to ask about the conclusions.
Sorry, doctor, we have a little problem in here.
When you conduct this study, and what method do you use to conduct this study?
Methodology, we study use a case series design employing QAAG and ARP technique to analyze the natural activity of young adult women while listening to music and mural doctor.
Who is the interpretation of QEEG and ERP analysis?
Presenting we
hospital or someone else?
On hospital doctor in
who read the interpretation of QEEG and ERP?
Okay, I can add the answer. This is quantitative electroencephalography is quite different with qualitative electroencephalography. Qualitative electroencephalography usually used in like in neurologist field. The qualitative electroencephalography usually find the abnormal pattern of, mohon maaf ada gangguan.
So by neurologist doctor or by psychiatric?
Ya, jadi this method we use to evaluate the power alpha. This is quantitative electroencephalography. Use the application from the EEG. We focus on the power alpha when the subject apabila subjek diberikan stimuli suara ini. Jadi I use in Indonesia dia.
Oke, Dokter Yusuf.
Jadi jadi ini perekaman selama 2 menit baseline, 2 menit 3 menit mendengarkan musik, terus kemudian mendengarkan murotal Quran ya. Jadi ERP itu adalah metode tradisional di mana ini kita menangkap perekaman sampling selama 10 detik. Jadi 10 detik itu membandingkan power alpha saat mendengarkan musik atau murotal dikurangi power alpha pada saat baseline dibagi ERP pada saat baseline kali 100%. Jadi mengevaluasi berapa persen kenaikan power alpha di setiap 22 regio elektrode itu. Jadi ini memang hampir sama dengan penelitian yang sebelumnya tadi dilakukan oleh Mbak Nanas tadi, yaitu memang terdapat lateralisasi ke kiri, kalau salah saya lupa, untuk kenaikan ini regio-regio otak yang lebih dominan sebelah kiri, tapi dikaitkan dengan dihubungkan dengan mohon maaf. Jadi ini intinya adalah lebih banyak dominan di sebelah kiri. Terus kemudian ini tergantung pada pengalaman subjektifnya. Kalau tadi disebutkan dia menikmati, terus kemudian terbayang ada visualisasi dalam imajinasinya ketika mendengarkan musik atau murotal, itu dari 4 responden ini ada yang sebagian naik, ada yang sebagian turun. Mereka yang cenderung pengalaman visual ya ketika mendengarkan musik atau dengan mendengarkan murotal Quran, itu terdapat kecenderungan denyut nadinya makin turun. Artinya semakin rileks kalau ketika ada responden yang menyatakan dirinya tidak ada bayangan sama sekali ketika mendengar ini, denyut nadinya naik begitu. Itu Bu Nining, Dr. Nining, mohon maaf, I use in bahasa to answer your question.
Thank you, Dr. Yusuf. It's a very interesting paper, Dr. Yusuf, and the team. Okay, before we go to the next section, I forgot to ask you to take a photo for each section. Yeah, maybe we can take the photo session from the first or the second presenter. Please turn on your camera. Maybe
Mbak Nana, you can stop your stop share.
Please stop your screen. Kan Hairun Nisa.
Yes, Doctor. Thank you, Doctor.
And I will take the photo, okay? One, two, three. Thank you. We go to the third section. but actually, and this is the last presentation from Dr. Yuni. Dr. Yuni has two paper. So
Last but not the least.
the the closing nih, Dr. Yuni. It's okay,
Thank
Dr.
you,
Yuni.
Dr.
Are you ready?
Nining, for waiting me. I'm sorry. Okay, I would like to open my presentation now.
Mm.
Okay, are you see our presentation, Dr. Nining? Is our sound is clear?
Yes, okay.
Okay, thank you. So I would like to show. Thank you for the opportunity in this afternoon. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah, in this afternoon, I would like to presentation our study with our team is Rika Arianti and my husband, my roommate, about the study of the impact and on the impact of age and resident on the occurrence of tuberculosis osteomyelitis. This is first to introduction. Why we are interested in this study? Because tuberculosis is an infectious disease. The disease is one of the top cause of death in the world, but is often found in the developing countries. As many as 10% until 25% of them are musculoskeletal tuberculosis. And with global prevalence about 18 until 38 million cases. In other side, the other person is a higher risk of getting. Sorry. As many as 10% until 25% of them are musculoskeletal tuberculosis, with a global prevalence at about 18 until 38 million cases. The other side is the older a person is, the higher the risk of getting exposed. But the other studies suggest that it has no association with this disease. So why we interesting about the age in this study. And on the other side, the other study says the development of this disease in urban area is 1.5 times more than in rural area. So the purpose of study was to analyze the influence of age and place of residence on the incidence of tuberculosis or osteomyelitis. The method in the study used a cross-sectional design. The sample taken from 106 histopathological preparation of the orthopedic section in the anatomical pathology laboratory of medicine faculty UMS that met the inclusion criteria, of course, with comprehensive sampling technique. And data were analyzed using experiment and research tests. So, in this is the first result. The most age in the range of 26 until 35 years, with a percentage of about 30%. The most patient residents are found in urban area, with a percentage about 86%. It is the biggest. The result of the test of the influence of age and the incidence of osteomyelitis tuberculosis will have a value about 000. This is less 0.005, while the effect of resident on this disease will be value about 0.8. And then we can see the characteristic of research. We can see most of the patient with tuberculosis osteomyelitis in reproductive area. And when we can see the interesting distribution in the patient most of in the urban area, but 86%. So the research is analysis of the influence between age and the incidence of tuberculosis disease is a p-value of 0.00. So we saw that there is a significant effect between age and the incidence of tuberculosis disease. And also we can see this interesting point in this table is we can see age until 0 until 5 and Indonesian family balita. You can see 100% have tuberculosis disease, and this distribution of age about 46 until 65. You can see the proportion is 70%. So this is the biggest in this 2% to age. And then analysis of the effect of incident with the incident of tuberculosis disease, we can see the value more than 0.05, and this there is a significant relationship between location of residence and tuberculosis disease incidence. In this study, we can see another point, just not a result, but we can see interesting point in this study. One is with a rate of 86%, the majority of patients live in cities, not a village, about 178 people. And the distance from the residence of the nearest mountain, about 10 kilometers, is used to identify the type of dwelling in urban and rural regions, using the measure distance and area of Google Earth. 2. On average, adults with TB or tuberculosis had a positive smear test result, but the children have a lower risk of spreading the sickness, because tuberculosis germs are extremely rare in children in the bronchial secretion. So this is why in this result, in this first result, I mean more patient TB in reproductive age, about 40, 25 until 40 until 45 age years. So this is our conclusion in the study. There is a statistically significant relationship between age and the occurrence of incidence of tuberculosis, and there was no significant relationship between residence and the occurrence of tuberculosis osteomyelitis. Most respondents between the age of 26 and 35, as much as 20% have have a place to reside in the metropolitan region as many as 86%. So I mean this is our plus represent the regulation that many people are still family the pressure of health and time. So this is our presentation in our first paper.
Okay, thank you, Dr. Yuni. Maybe Dr. Yuni can present the next paper.
Okay, thank you. This is the last presentation. This is the you see our presentation.
It's clear, Doctor.
Do you see? No.
Yes.
Yeah, but I mean,
It's okay, Doctor.
okay. But I don't make the slideshow mode. It's no problem with this mode. The training. Okay. Okay, I will. Okay, thank you. To continue our presentation with our second paper, which is titled Study of Estrogen Receptor Phenotypes Based on Age and Body Mass Index in Breast Cancer and SD type. This is our team, University Kurniati, Nabila Maharani, and then Lisanul Latifah. Why we interested in this title? We we introduce in this PPT. Introduction is breast cancer is the leading cause of death in women. Globally, there is an increase in the number of breast cancer sufferers from 60,000 to 1,043,000 with an annual growth of 3%, and the number of deaths is 40,052 in per person. In Indonesia, this disease is also a type of cancer that ranks highest in women. The increase in the incidence rate of breast cancer is believed to be related to the increasing number of risk factors. Age is an independent risk factor. The increase in the incidence of obesity with age also increases the risk of developing breast cancer. In other side, this cancer molecular phenotype is categorized based on the expression of hormonal receptor and human epidermal growth factor receptor 2, or which is HER2, and estrogen PR and HER2 receptor. There are still few studies examining the risk factor for these three molecular phenotypes worldwide. So, I mean, a good understanding to risk factor, we can research in this research can help control the disease more effectively. Purpose of study is to analyze the estrogen receptor molecular phenotype based on age and body mass index in pathological preparation of breast carcinoma with diagnosed invasive or special type. And this is the most type in breast cancer in the worldwide. The method, the research design use observational analytic with a cross-sectional approach. This research was conducted at a referral hospital for 2 cases in the Surakarta area and surrounding district. The sample in this study were all anatomical pathology, medical record of patient with invasive of no special type breast cancer, which were complete with an estrogen receptor immunohistological examination. The research used a purposive sampling technique with a research sample size about 134 samples originating from the period 2015 until 2015. This research using primary medical record data according to the inclusion criteria. Then data analysis use the chi-square test. Let me introduce our first result. This is a variable from our sampling. The large distribution of sample with non-obese BMI was 80 samples, about 60%. The large distribution based on age was 114 samples, age over 40 years, about 85%. And then the result of the estrogen receptor phenotype examination with highest score with negative, about 94 cases, and cases about 70%. Another result in our studies is analysis of the relationship between age and estrogen receptor molecular phenotype in NSD type breast cancer is about 0.297. It is less more than more than 0.05, and then Another result is analysis of the relation between the body mass index and estrogen receptor mobility about p-value about 0.008 is more less than 0.05, and then we can say it is a relationship between body mass index and estrogen receptor molecular phenotype weakness type. So, I'm sorry. This is another result in our paper is in any interesting value and novelty in our research, because this is I give you just a few studies about immunohistochemia in breast cancer, about estrogen receptor factor in this preparation. First is there is a relationship between obesity and estrogen receptor positive molecular phenotype. The estrogen receptor is one of the main prognostic and predictive factors examined in breast cancer. The estrogen receptor is expressed in approximately 70% of breast cancer, known as estrogen receptor positive. Estrogen receptor status is used to determine the sensitivity of breast cancer lesion to anti-estrogen therapy and to assess the sensitivity to preventive chemotherapy in women who have a high risk of breast cancer. Second novelty is the research provide information about factor proven to be associated with breast cancer, namely obesity. Therefore, women are advised to adopt a lifestyle that can maintain health and prevent obesity. The result of the study can be used as a consideration for assessing the prognosis of breast cancer sufferers. So I mean, actually for breast cancer sufferer must be preferring to and change her lifestyle, because this is upon important value to be higher, to be more better prognostic and predictive. I mean, this is why it is an interesting point and novelty. And also the conclusion in this paper is there is a relationship between obesity and estrogen receptor molecular phenotype with p-value about 0.008, and there is no relationship between H and estrogen receptor molecular phenotype with p-value about 0.285. This is same as in my first paper. There are two questions that many people are deceived by memory of that big time. Thank you. This is last presentation. So I will be continue to continue. Thank you.
Okay, thank you, Dr. Yuni Prastya Kurniati, for the presentation.
Yeah.
Okay, we will continue to our discussion sections. Maybe from other presenter or listener can ask the questions.
It's too afternoon. Maybe all of the participant is too tired.
Is anyone raise your hand? Is there? Maybe I want to ask a simple question, Dr. Yuni. Where is the study of the breast cancer conducted?
In this Surakarta city, with preparation from to hospital. And but it is a referral hospital. I mean, this hospital is rujukan center of referral in the breast cancer, because our hospital have oncologists and this is a super senior oncologist. Yes.
So all the sample are analyzed using pathology anatomy.
Yes, yes,
Okay.
but not just me. This is from our collegial, from patholocollegial, and this is this is not a pathology diagnose, but more than that, because we have in this method have must be complete with immunohistochemical analysis with estrogen or estrogen receptor and progesterone receptor, HER2 receptor, and KI67, KI60. Yes. So yeah.
Okay, thank you, Doctor. Okay, for the first paper, Doc, a study of the impact of age and residence on the occurrence of tuberculosis osteomyelitis.
Yes.
Is it the prevalence of tuberculosis osteomyelitis is high in Japanese or in other province?
Yes, this
In
is
Indonesia, actually.
yes, this is interesting question, Ternining. This is why we interest of the topic, because if just tuberculosis, pulmo or lung tuberculosis is many many research about that, but inclusion khusus ya, special in this tuberculosis osteomyelitis, it is not just a few studies about that, and then we don't know what the answer of your question about because just a few studies about tuberculosis, and then I think this is other title we can research bersama dengan Dr. Nining nanti. We can see about spreading of the personalities in Japanese and other out of Japanese, because this preparation from same as referral hospital in Indonesia about musculoskeletal preparation in this orthopedic section.
Yeah, thank you, Dr. Yuni.
Thank you again.
Before we end this section, maybe we can photo again, Doc. Take the photo again. So in the third section. Okay. Dr. Iin still Dr. Iin udah live. Okay, 1, 2, 3. Okay, thank you, Dr. Yuni and all participants. Okay, before we end the discussion, I need to remind the participant click the attendance presence on the Google Forms. Then we will continue this section at the main room, right, Dr. Burhan? For the the final penilaian nih. Okay.
So we move on the main room.
Okay. Wait a minute. I asked the Bu Andin said that we will announce the presenter. Okay. Okay. Okay, please wait before we close the ceremony. We wait from the second room. We will please stay at this room before the announcement for the favorite speaker or maybe the first and the second presentation. Meanwhile, you can turn off your camera and your microphone. We will wait the attendance from the second room.
Assalamualaikum, Dr. Nining.
Waalaikumsalam.
Bu Andin. Yeah.
Ya, oke. Salam. Apa? Masih menunggu ya, komplit.
Bu Andin, maybe this the presenter that could be joined in the second room, from the second room.
Only 11? Only 11 presenters?
Maybe they are still on the way down, on the way home.
Oke. Apa bisa kita announce sekarang sekalian ditutup ya?
Yeah, di-announce saja, Dok.
Yeah. Okay, for all participants and for judges, Dr. Burhanuddin Ihsan and Dr. Nur Mahmuda, we kindly say many thanks for attending in this session. There are about 20 presenters who is already present his or her topics of the studies of the research, and I think all of you are excellent in presentation and in research topic, but it's hardly to say that we have to decide only one best oral presenter in this moment. Nggak apa-apa ya, pemenangnya cuma satu. I think it's okay.
Semua sudah pemenang Bu, yang disaring di sini.
All of you is a winner, but it is hard to say that committee just has to decide only one best presenter for medicine section. And herewith I announce that the best presenter oral presentation is
Jeng jeng jeng.
is
Backsoundnya ya, Dok.
Saya share screen ya, biar tambah deg-degan. Okay, and the best oral presenter is give to Dr. Novita Nurhidayati Mahmuda. Topic antiviral and symptom-free days for confirmed COVID-19 students. Bu In are you still here?
Sudah praktek seperti itu.
Okay, it's no problem. And sudah ya berarti? Sudah cukup ya berarti?
Yes, Doctor.
Yeah. Okay. Yeah. The certificate will be sent after this after this day by the committee, and because of all of the presenter and the presentation is already finished, we would like to close this session. Again, I would like to say thank you for all participants and all judges and for moderators. We hope we meet again in the next seminar. Billahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you,
Thank you, Dr. Yusuf, Dr. Yuni. Thank you,
Thank
Dr.
you,
Sahila.
Dr.
Thank you for all students. Thank you for all
All
students.
presenter.
All presenters. Thank you.
Cimbis ya, matur nuwun. Thank you.
Assalamualaikum warahmatullahi wabarakatuh.